Hi, thanks for joining us. You're listening to the Health Essentials podcast brought to you by Cleveland Clinic. My name is Cassandra Holloway, and I'll be your host for this episode. Today, we're broadcasting virtually as we are practicing social distancing during the coronavirus pandemic. We're joined virtually by Dr. Mohamad Chaaban. Dr. Chaaban, thank you so much for taking the time out of your day to talk to us.
Good morning. Thank you so much for having me today.
In this episode, we're going to be talking about nosebleeds. Everything from who gets nosebleeds to how to treat and prevent them to more serious cases and what it could mean for your health. Before we dive into the episode, we want to remind listeners that this is for informational purposes only and is not intended to replace your own doctor's advice. So, Dr. Chaaban, I first want to start off by asking how you're doing and if you'll tell us a little bit about your practice at Cleveland Clinic and what types of patients you see.
Thank you. I'm doing well. I see patients at the clinic with mostly with sinonasal disorders. As an ear, nose, and throat surgeon, I also specialize in rhinology, which is a discipline of treating patients with sinus, nasal, and skull base disorders.
So most people will experience a minor nosebleed at some point in their life, so it's pretty common. When someone is experiencing a nosebleed, what's actually happening? Where's the blood coming from?
So most of the nosebleeds, or we call it epistaxis, is coming from the anterior part of the nose, which is the nasal septum. And this structure separates the two nostrils, and most of the times it's from the front part of that structure, which is the septum. And it is usually, by all means, it's usually spontaneous, so it's not usually triggered by any like tumor or trauma, and that's most likely cause of the nosebleeds.
And then you said usually it's from something more common, like a trauma or something. What about more serious nosebleeds? How rare are nosebleeds when something is pointing to something that's wrong?
Yeah, so there is about between 10 to 20% of nosebleeds can occur. We call them posterior nosebleeds, which is way back of the nose. And those are the ones that can tend to be more serious, where you get more blood draining back into the throat. And those are the ones that can be difficult to control. In addition, serious nosebleeds, I consider if there is a major cause, such as like a tumor in the nose, that to me is of course serious. In addition to underlying comorbid conditions that could be associated with the epistaxis or the nosebleed.
So with minor nosebleeds, on average, how long do those last? How long is normal?
So nosebleeds that are minor, usually they should not last more than about 20 minutes. And sometimes, obviously, you can do some measures at home to control the nosebleeds, which can be simply just applying pressure to the front of the nose, and so.
And who is more likely to experience, these minor nosebleeds from time to time? Is there conditions that put you at risks? Are there certain people who are kind of more prone to them?
So I like to separate those in terms of either demographic risks, geographic risks, and seasonal risks as well, basically, or factors. In terms of demographics, we see this more in as a bimodal distribution in kids about 3 to 10 years of age, mostly due to digital trauma, like nose picking, basically. And in the older patients as well, we see it. And the older they are, the more likely it will be a severe or recurrent bleed that may require an ER visit. Male gender as well. Males are more prone to have at least recurrent bleeds requiring an ER visit. In terms of geographic, northern states are more likely to have, people living in northern states more likely to have nosebleeds, epistaxis. In terms of seasonal as well, it's much more common in the winter months, such as December and January, as opposed to the summer months like July and August.
Makes sense when the air is a little bit more dry, kind of in those winter, colder months.
Yes.
Are there any other common non-serious causes of nosebleed that listeners should be aware of? Are there any medications or anything else that causes it that is interesting for listeners?
Yes, so anything that can make your nose dry can cause nosebleeds, which we talked about the winter months and the dry air as well, like living in high altitudes, another risk as well, such as that causes nose dryness. If you're taking some medications that can make you dry, like antihistamines, decongestants, topical nasal sprays. If you're applying topical nasal sprays, sometimes the actual bottle can irritate the nose and also can dry the nose. And blood thinners, by and large, will at least will make you have a longer nosebleed if should it happen. Patients have allergies because they have a lot of nasal congestion. They're blowing their nose. They're sneezing can cause nosebleeds. If patients have upper respiratory infections, exposure to chemicals as well, smoking as an example, can increase. Obviously, there are other reasons. Could be a tumor after surgery. All those can also trigger nosebleeds as well.
And I think when you mention a tumor, I think it's really alarming to people. So I want to talk a little bit about that. How common is a nosebleed for a symptom such as cancer or a tumor? Is it something that people should be really concerned about? Is it just kind of a warning sign to keep an eye on? I want to kind of get your thoughts on that.
Yes. So basically, if it's a nosebleed that happens suddenly and typically, I see it more associated with other symptoms like pressure in the face or numbness, then I would be very concerned about this being a tumor. Now, any nosebleed should usually, if it's recurrent, should usually be examined for the source. The location is the most important. Whether it's in the front of the nose, back of the nose, or actually coming from a tumor. That usually requires, obviously, a visit to the ENT, ear, nose, and throat physician.
And how do you define a reoccurring nosebleed? If someone is experiencing one or two, kind of what's the number, I guess, to kind of for a red flag to go off in your head for maybe this isn't right, maybe I should get this checked out?
So if they have one-time nosebleed, usually that goes away and doesn't require any attention, I like to talk about them more about the severity, because if they are, the more severe they are, if they require a hospital, like an ER visit, and we know it's not as common, about only 0.5% of nosebleeds would require a hospital visit, like ER visit, and only 0.2% would require hospitalization, for example. So they're not as common to require that much attention. So by and large, even if it's recurrent nosebleed that's not severe, usually can be not alarming and could be treated, at home without requiring you to go to the ER or seek attention.
Gotcha. And what about like bleeding disorders or blood clotting disorders? Are bloody noses ever a symptom of that, of kind of a warning sign?
Yes. So it's an interesting story. I had a patient one time who actually came to my office and had like 4 bottles of a blood thinner, and she did not know that each one is a blood thinner, and some of them was the exact same medication. So she basically showed me the bottles and was taking a pill from everyone. So blood thinners can be, if you take them in without checking the blood levels for in certain types, then it could be a very big risk of you developing a nosebleed. So yes, it is quite major, it's quite important. And it also, when you see the patient and you diagnose them with a bleeding disorder, it's not only the nose, they could be at risk of bleeding from other places such as the brain. And that's why we need to stress out that people on blood thinners need to always watch and make sure they have a good diet that doesn't increase the bleeds, such as the greens, and also make sure that the levels are checked so they don't develop any other bleeding in other sites of the body.
And I assume with other medications, kind of just be aware of the side effects, and if it's interacting, weirdly with your body, just to have that conversation with your doctor if medication is causing your nosebleed or anything like that, kind of just to be aware that it could be a symptom.
Yes, absolutely. Absolutely.
So I want to go back to a couple of the causes of nosebleeds. So we mentioned people living in like high altitude areas. Is it because just the air is drier and that kind of irritates the nose a little bit more?
Yes, the water vapor in high altitude is low, so there's more dry, and dryness can cause desiccation in the nasal mucosa and subsequently trigger the nosebleeds in those patients.
Do people living in these areas, will they ever become kind of accustomed to the altitude where they're not getting as many bloody noses and they get used to it?
Yes, so mostly the sudden changes is more, I've seen it more cause nosebleeds as opposed to someone living there for a long time. So those changes and can cause more, can trigger more nosebleeds, temperature changes, and the dryness. If it's more sudden, I see it more triggering the nosebleeds as opposed to someone who has been there for a long time. It's been chronically exposed.
Sure, makes sense. So here's a wild card question for you. Can pregnancy cause nosebleeds?
So there is increased. That's an interesting question. So there's increased blood volume in pregnant females, and what happens is due to also hormonal factors, they are at risk of bleeding, of bloody noses. Yes.
Interesting. So I want to talk a little bit about treatment. So if someone just has an occasional, random nosebleed, how do they treat it? What should they keep in mind?
So I also want to discuss severity in that situation. So if it is severe nosebleed, even if a one-time severe nosebleed that requires, for example, a visit to the emergency room, let's say, that usually the patient ends up seeing me in clinic, for example, after a few days without like bypassing primary care physician, for example. So minor bleeds can definitely be treated at home, as you said, and patients, I would recommend leaning forward, you know, um, pinching the nose. If they know which side it is, they can pinch only that one side or both sides if they're not sure where it's coming from. As we said, it's mostly from the front of the nose, so if they pinch really hard, bend forward, we don't want the blood to trickle back. And then wait about 15 minutes, and then they can check and see if it's still bleeding or not. If they do have Afrin at home, they can always squirt Afrin and then pinch their nose as well, and that controls the bleed very, very well if they're at home. In the severe bleeds, obviously, when they come to see me, then they may have had a packing in the nose. I may have to take a look and see where the bleeding is coming from, and then do a complete examination.
And if a patient, makes their way to you and they're seeing you for reoccurring nosebleeds, what are some of those treatments? I know cauterization is something that I've seen. Walk us through kind of how you would maybe treat a patient with reoccurring nosebleeds.
So the location is the most important, the etiology and the location, I would say. So if it was a septum bleed, like from the structure that we talked about, we take a look in the nose, and usually the anterior bleeds, which are the most common, you can cauterize them in the office. You can use silver nitrate, for example, which is a simple procedure in the office, and cauterize them. If it was more severe bleed, posterior bleed, or the middle of the septum arterial bleed, then sometimes it require backing, and then if that fails, then you may have to go to surgery and cauterize them with electrocautery. The posterior bleeds, sometimes if they're severe and they reoccur, we either tend to ligate the artery with the surgery that we do, or do embolization, which is done by interventional radiology as well. But those are for patients with severe bleeds or recurrent bleeds, and it's not just for everyone. We have a protocol that we use for those kind of patients.
Sure, absolutely. And if a listener is listening to this and they have these frequent nosebleeds, do they make an appointment with an ENT? Kind of what are their steps here?
So one-time nosebleeds or nosebleeds that they can control and they're not, and they're not as frequent, then obviously they can manage them at home. But if they recur, there's always good to check with their primary care physician, simply because there are a lot of comorbidities that they need to pay particular attention. For example, hypertension. We know in many studies has been shown to be a risk factor, and so they need to check their blood pressure. Other comorbidities like sleep apnea, diabetes, congestive heart failure can put them at risk of severe bleeds requiring them to go to the ER more often, like frequent visits to the ER. So checking with the primary care doctor is always very beneficial to make sure the comorbidities are okay, there's no underlying condition. Sometimes could be a genetic condition that could be predisposing them to cause bleeding, and that could be very severe and could happen in other parts of the body as well. And it can happen any time of their life, by the way. It doesn't have to start when they're young or anything. So always I would start with the primary care. Just make sure they they have a good exam and making sure the comorbidities are checked. And if and they continue to have problems, or if they have severe nosebleeds, those two, they end up requiring to be seen by an ear, nose, and throat doctor, specifically to do a nasal scope so we can find out where the bleeding is coming from.
Absolutely. And it's just a message to listeners, get it checked out. If it doesn't feel right, or if you're noticing something, always best to get it checked out for sure. And I'm curious, with today's crazy world that we're living in, can nosebleeds be caused by stress and anxiety? Do you ever see any kind of correlation between that?
So this has been studied multiple times before. I think I always see them coexist, at least. So I have rarely seen a patient, unfortunately, that comes to your office that has a nosebleed and that's not stressed out about what is causing the nosebleed, how to stop the nosebleed. It's a very stressful situation, and what happens with stress is your blood pressure goes up and your heart rate goes up. So it's not actually helping the condition, your bleeding. So, and many patients, when they come to the ER and I come to see them after they consult me, for example, as soon as we calm them down, the bleeding stops usually. And so it's a vicious circle. You get the bleeding, you're more anxious, and the blood pressure, heart rate goes up, and you bleed more. Once we break that cycle, patients calm down, and at least they feel also they're safer when they're being taken care of at the medical office or in the ER, for example.
Sure. And it's jarring, there's usually a rush of blood and then a rush to contain it. And it's scary for sure.
Absolutely. Absolutely.
So with reoccurrent nosebleeds, I'm curious, do those ever cause iron deficiency? Is that something that people should be concerned about?
Absolutely. I have seen iron deficiency in patients who have recurrent nosebleeds, particularly patients that may not, may delay, care for these conditions, in especially severe cases or in recurrent nosebleeds, even if not severe, but they're not taken care of, they're not stopped. So that recurrent bleeding over time, if it's frequent, then can cause iron deficiency. And if they have other bleeding disorder or the bleeding from other sources as well, that could cause iron deficiency.
And is that just treated with your typical iron pills, or does it depend?
It depends, absolutely. Depends on if it's just iron deficiency or other conditions that the patients have anemia from. But what I would recommend, usually those patients with recurrent bleeds, they need to see that primary care doctor to look at their comorbidities and to look at other sources of bleeds if they have iron deficiency. And if it's truly just iron deficiency, obviously they will put them on iron pills.
And with talking about nosebleeds in general, I'm curious, how serious can a nosebleed be? Is there people that should be concerned about a serious, severe nosebleed?
So the good news is nosebleeds rarely require, as we said, only 0.5% ER visit and 0.2% hospitalization, and also very rare to be severe, like causing to be fatal or death, very severe. But I would be concerned in patients with, like, older patients with posterior nosebleeds that did not seek care and that continues to bleed, obviously, and those require usually obviously packing and ER, at least an ER visit for taking care of it, and controlling their comorbid conditions, including like diabetes, for example, sleep apnea, and those are risks for them to develop, as we've seen in our study, recurrent visits to the ER with bleeding again, with rebleeding. Other than that, I would also be concerned in patients who have potentially tumors in their nose or vascular tumor in their nose. Those are the ones that I'll be very concerned about them bleeding again and profusely bleeding. And obviously, after sinus surgery, I would be also concerned if there's a bleeding that is also uncontrolled as well.
But again, not very common.
No, not common. It's very, very uncommon. That's the good news. Most nosebleeds are, as we said, they are spontaneous, and they don't require ER visit by and large. They're not severe.
So with drier winter months quickly approaching us, for listeners who experience dryness in their nose or irritation in their sinuses, what are some at-home remedies they can do to kind of cut back on the dryness and the irritation that they feel in their nose?
Thank you for that question. So what I recommend if patients have, obviously are at risk of nosebleeds, is to have a humidifier at home that could obviously decrease the dryness. And what I recommend as a regimen for my patients when they're known to have recurrent bleeds during the dry winter months is to actually apply an ointment twice daily. It's water-soluble ointment, and some of them could be over-the-counter as well. And that's applied twice daily. And during the day, they can also use a nasal saline spray to keep their nose moist. If they are using nasal sprays, drying nasal sprays, or any nasal sprays, I always want to make sure they're using it the right way, which is aiming the spray towards the cheek on each side. I always say right hand, the left nostril, left hand to the right nostril. So you're not aiming it to the septum, which is the structure that we talked about that usually is where the bleeding happens. In addition, obviously, if you keep your nose moist and avoid nose picking, obviously, and avoid any nose blowing, straining, and sneezing. So if you control your allergies, if you have allergies, that would also avoid these and avoid you from getting recurrent nosebleeds. In addition to avoiding chemical irritation such as smoking and such.
I think it's a good reminder just to be gentle when you're blowing your nose or you're dealing with your nose, especially if it's already irritated.
Absolutely.
So the last thing I want to talk about today is prevention. So we mentioned, not smoking. If for listeners listening to this, how can they prevent nosebleeds from happening, especially if you're more prone to them?
So most important is, as we said, the most common are the spontaneous anterior bleeds, mostly due to dryness and obviously colder temperature. So by keeping the nose moist, perhaps having a humidifier, applying a lot of saline, and sometimes I use ointments in the nose that could be helpful and could provide some moisturizing effect. Avoiding irritants, like you said, smoking, avoiding that, and obviously, if you work in a place with a lot of chemical exposure, perhaps having some protective equipment would be very helpful in that case. In children and some patients, avoid nose picking or digital trauma is very helpful. In allergy patients, maybe controlling the allergy is important. This way you don't have to be sneezing as hard or blowing your nose, and avoiding this irritation that can cause bleeding. These are all factors that could be, and also more important, if you're on blood thinners, make sure that the levels are acceptable so you don't end up losing a lot of blood.
Absolutely. Great advice to end on. So thank you for taking the time to talk to us today, Dr. Chaaban. You've shared a lot of really great insight and advice. I know listeners will be find this very valuable.
Thank you so much. Thank you for having me.
To make an appointment with a Cleveland Clinic ear, nose, and throat specialist, call 216-444-8500. If you want to listen to more Health Essentials podcasts from experts at Cleveland Clinic, subscribe wherever you get your podcasts from or visit clevelandclinic.org/HE podcasts. Also, don't forget, follow us on Facebook, Twitter, and Instagram at Cleveland Clinic, all one word, to stay up to date on the latest health news and information. Thanks for listening and stay safe.